Whether you're in recovery from an eating disorder or you're just trying to build a better relationship with your body, with body respect and acceptance, being weighed at your doctor's office can be all the way from anxiety provoking to completely derailing. You may also want to be sure that you're receiving medical care that is holistic in nature and not focused solely on your weight. In this video, I'm going to be talking about how to ask not to be weighed by medical professionals at your appointments and start taking steps towards a more health at every size approach to your medical care. On this channel, we talk about all things from health at every size to intuitive eating to how to have a better relationship with your body. I discuss the science behind why people overeat and struggle with binge eating and give you tangible take-home strategies that you can use to have a better relationship with food and your body. If this sounds like just what you need, subscribe to the channel and hit the bell in the top right corner so you're notified when I publish a new video. I publish every Wednesday. I'm Meredith MacKenzie of Parallel Wellness, and I'm a registered clinical counselor and an intuitive eating coach. I've helped hundreds of women who struggle with poor body image and loss of control with eating to fully attune to their body's hunger and fullness needs and to go on to live happy and fulfilling lives, leaving diet culture behind. What do I do when my doctor or the nurse at the doctor's office wants to weigh me during an appointment? This is something that comes out of the mouths of my clients so often. They're fearful that if they get weighed, they're going to be stigmatized against, or that it's going to be so overwhelming for them emotionally. And so we need to recognize the inherent weight stigma that comes with weighing patients when they go to medical appointments, when in many cases it has nothing to do with their physical wellness and the care that they're receiving at that particular appointment. Really what we're doing in this video is challenging the way things have always been done. And that's a lot of what we have to do in the medical system when it comes to, empowering ourselves and to standing up for ourselves for people in larger bodies. But that is what you're doing. And that's why it feels so hard to do. Now in Canada, this has never been an issue for me, but I have heard of American clients who are concerned that if they ask to not be weighed, can their insurance refuse to insure that session? And what I've heard resoundingly is that no, your insurance cannot not provide payment for that session if you don't get weighed. And if you are challenged on this, the nurse or whoever is recording it can say, they refused to be weighed. And it just has to be a filled in box rather than having a particular number in that box. On a basic level, you as a patient have the right to decline and not give your consent to any intervention that your doctor recommends. And being weighed is a type of intervention that is happening at the doctor's office. So you have the right to say, no, I do not want this to happen. Now, I'm going to recommend a few steps that you can take, and I want you to choose the one that feels best for you. I've kind of put them in an order that you're kind of sequentially going through them with greater and greater confidence if you can. But if you're feeling a little unsteady and unsure of doing this for the first time, start small and you can just start with some questions. So this is where you can just ask the person who's wanting to weigh you, is it medically necessary for me to be weighed during this appointment? You're not saying no, but you're asking for more information. Yes, there are situations where it's required to have your weight, such as when you're trying to determine a medication dose, right? You want to be receiving the correct dosage that's going to work on your personal physiology. And if the doctor doesn't have your weight in that situation, then that's going to be hard for them to do. And quite honestly, it'd probably be irresponsible of them to be prescribing you a medication without knowing that it's going to be the correct dosage. So in that situation, sure, they might need to know your weight, but a whole host of other reasons or situations, it might not be necessary. So just asking, is it necessary at this particular appointment to do this, to have my weight as a part of that? And that not only, asserts that I only want this done for a particular reason, but it also helps that care provider to get a message that maybe they haven't been challenged on before and help them start thinking about things differently as well. You can also get curious with your doctor. If your doctor is suggesting something like weight loss or changing your physiology in order to improve your health, get curious and say, would the care that you're giving me or the recommendations that you're giving me right now change if I was in a different sized body? Again, I did a video last week on weight stigma and healthcare, and so if you're curious about that one, I'll link it right here for you to watch. But sometimes doctors will do things without fully realizing how much internalized weight stigma that they have, and that it's something that's impacting how they're interacting with their patients and the care they're providing. And so there are situations where doctors will give a recommendation of weight loss for a particular set of symptoms, whereas in another case, if somebody was in a normal sized or average sized body, that they might have recommended something different. And so asking, would the care you're giving me change if I was in an average sized body or if I was not in the body that I am? Now, when it actually comes to declining, start casual. If someone is asking you to be weighed, you can just simply say, "Oh, thanks." And that might be confusing at first, right? But you're just, "No, thanks." And if they say, "Well, no, like I need you to get weighed, let's do this." And you can say, "No, thank you, not this time." If they really push at it, you can ask, is it for something that's medically needed? Is it for a medical dosage, or what's going on here? And if they don't give you an answer that aligns with that, then you can just say, "Okay, no, thank you." You can just write that I declined this time. And so it's not actually saying flat out no. And so I hope offering this opportunity, just do it casually, will help ease some of your anxiety about doing it, but give that one a try. Now, I want to know about your experiences of being weighed at the doctor. So comment in the comment section down below and let me know if you had a particularly difficult time or any time that went really well and what it was that you think went well, so you can share some of those ideas with the other people who are watching this video. My next tip is to be unapologetically assertive. And this is a hard one. First off, being assertive is hard for many of us, as well as being unapologetic about it. And that's another part of assertiveness. But you can say, "No, thank you. I don't feel comfortable being weighed today, so I'm not going to." That might feel jarring. That might feel uncomfortable for you if you've not done that before. But letting the person who you are working with know that it is a matter of comfort and it's not something that you want to do is important, right? You are expressing what it is you need in these medical appointments, and it helps them to provide you with more client-centered care if that is something that you're concerned about. Now, as I said, in some situations, it is medically necessary to get your weight. And if this is something that's happening, but again, you're feeling so uncomfortable with it, and knowing your weight might derail the progress that you've been making in your own recovery or in your relationship building with your body, you can ask to be blindly weighed. It's a compromise. They are still going to get the information. They are still going to record it in your file. However, you don't need to know that weight. And most people, in my experience, this is what I do when I go to the doctor, are incredibly respectful of this. And they will make sure that they press the off button before you turn back around. And quite honestly, I have not known my weight in, I don't even know how long, over 15 years at least. And it's not something that's ever bothered me or ever impacted my medical care. I don't need to know my weight. That's not something that I need. So if it's something that's needed for medical purposes, you can say, "Okay, I'm okay with doing this, but I don't want to know the number. It's something that's important to me to just not know. Can you blind weigh me? Can I turn around on the scale?" And that's something that they're able to do. In addition to this, you can be very clear with your medical provider and anyone who's providing you with any, paperwork or anything like that, that you don't want that information discussed with you or included on that paperwork because it's something that you don't want to talk about. And that is okay. Now, my next recommendation is really going full force into that self-empowerment and promotion of health at every size care within your doctor's office. But this is to encourage or ask your professional that you're working with to shift to talking about other health outcomes or measurements of health rather than weight. And so this conversation might go something like, "I've been working really hard on my relationship with my body and food, and I have found that in the past, focusing on my weight has been overwhelming and not good for my relationship with myself. I would like to move my focus to other determinants of my health, and that's something I've been doing personally, and I would like to bring it into my work with you, if that's possible." You might even want to share, "Stepping on the scale for me is really triggering, and it's something that I don't like doing, so I would like to not do that again. Are there other measurements that we can use to determine the progress that I'm making or my health at any given appointment?" And so not only does this, open the lines of communication between you and your healthcare provider, but it also encourages them to think a little bit outside the box or think in a more broad way to other measures of wellness, right? This might look like Well, how well are you eating? How are you moving your body? How do you feel physically? How is your sleep? How is your mood? All of these things that might determine your health, as well as all the other measurements of your blood values and all of that kind of stuff, but to encourage them to not focus on the simplicity of that specific weight number. Now, in the future, this is going to be something that might keep coming up. And so you also have the option during this appointment to say, in the future, I would really like weight and weigh-ins to not be a focus of my appointments, and I would like to focus more on other health outcomes. Can we please have it noted on my file that I don't want to be weighed and that this is something that I won't be consenting to in the future unless it's medically necessary? And so that is something that can be written on your chart, and that hopefully then whoever else comes across your chart and is doing that initial piece before you get into the doctor's office will be informed of that before they bring you in. Now, I know that this is a lot and it's a lot to take in, and it's going to take some practice, and you might even need to script it for yourself. So I am including in the link in the description box down below a little freebie for you that has all of these steps of what you can say and what you can do. And I've also included a card. I'm not the first one to develop a card like this, but a little business card shaped thing that you can print off for yourself and have put in your file at your doctor's office that says, please do not weigh me. And so that is something that I wanted to provide for you because I really want to see this go global. I want people to be assertive with their healthcare providers. I really want to see healthcare providers providing more health at every size approaches in their work. And so that's there for you. So check that out in the description box down below. Now, if you're liking these episodes on health at every size, I encourage you to click the link in the description box down below where I have the mini-series podcast that my student Hazel Jonas has been working on, where she talks to all different professionals about their experiences working with health at every size in their practice and some of the controversies of health at every size. And she really digs deep in it, and we're really proud of the work that she's done. So give that a click in the link down below and you can have a listen. If you found this video helpful, let me know by giving it a like and subscribing to the channel so you're notified when I publish a new video every Wednesday. And go ahead and forward this on, share it with a friend or a family member or anyone who you think would benefit from learning how to speak up for themselves and not be weighed at their doctor's appointments so that they can have a better relationship with their bodies and have a more health at every size approach to their medical care. And I'll see you next week. Bye-bye.